When doctors that are motivated by more intrinsic value to patients, when they're preoccupied with things that don't enable that can become a detractor from the provision of medicine. The conditions have declined to a point that we think they should just be able to take it, that they're paid well, so then they should be able to take on that burden. And we can try to improve the conditions to allow doctors to be their best. That will really change the dynamic.
I feel that healthcare has become more transactional than transformational.
Welcome back to Talent Hunters, where we explore insights and trends shaping the global recruiting and staffing industry. Want to build talented teams that drive your company toward big goals and big growth? Then this podcast is for you. And now, let's join the conversation with today's episode of Talent Hunters, brought to you by HireQuest. Connect with us at hirequest.com.
Ladies and gentlemen, my name is Vince Holt, and I'm the host of Talent Hunters. And today we have Catarina Dolsten, founder and CEO of the Aktum Group, as well as Charles Jones, the Director of Strategic Innovation with us. The Aktum Group combines data science with organizational psychology to create dynamic workplaces. Welcome and thank you both for taking the time to be with me today.
Thank you.
It's great to be here.
So, Catarina, let's start this thing off right from the ground floor. Please share with us what inspired you to start the Aktum Group.
Thank you. Well, it's been a journey for me. It's been because I come originally from Sweden, where I worked within healthcare and really enjoyed that job a lot. So then we moved to the United States, and there I started working in nonprofit organizations, primarily developing programming for mothers and babies in sub-Saharan Africa and Bangladesh. And it was really, really nice because instead of helping one woman now, I was helping 5,000 women. And that's when I ran across how important leadership and teams are. And I wanted to learn a little bit more about that. So I got a master's in organizational psychology and also in coaching. I got a certificate. And that's how I ended up here. Because when I've been working in all these different health systems, I see how system thinking has been so important and compare them with each other. And doing the master's in organizational psychology really gave me tools to do that, to understand people. And my focus is primarily people analytics within organizational psychology.
So if you could just break that down just a little bit.
Yeah.
Where you briefly said where your focus was, but where is your passionate attention to the needs focused on?
Right. My passion, I would say, is people in the workplace. So if we can make people in the workplace be happy and passionate with what they are doing, the workplace will be better, the organization will be better, and I even think that will reflect society.
Okay. So, Charles, where does your profession, your specialty, tie into that vision?
That's a great question. It starts where my journey begins, where I started in healthcare, drug discovery, and really I focus on how to bring medicines to patients faster. It's been a career there. And then I worked at Pfizer and a variety of other firms, and I was exploring what I wanted to do next. And what I saw and realized is what's equally important with solving the next drug to cure a disease is the treatment of people within a company. Because you need to unlock the potential of people to do things better. So that's where Catarina and her leadership at Aktum Group was really the first and only company I saw that was focused on that problem in a meaningful manner. So it was a great opportunity for me to expand my repertoire and dig deep and dig in an area that's going to provide value. So I'm happy to be a part of the organization that's doing something special.
Oh, it's fascinating. That's awesome. So I'm going to ask some questions here, and either one of you can answer them. It's fine. What emotionally drives the employees that work in the hospitals?
Okay. Catarina, do you want to take that?
Yeah. So, hospitals are really a very special place. People who go there, either as nurses or as doctors, they go in getting educated in how to heal and treat patients so that they will become better. So they're really value driven. So doctors really are also driven around learning and development. So science becomes very important for them because they know next year I'll get a new drug. I want to know how it works. And that's like a place where they can really channel their exploration and curiosity. So values amongst doctors is a few things. They want to have autonomy of what they're doing, and they want to do what they were trained to do. Those are the main things. Driven by purpose, compassion, service. And when healthcare systems are set up so that they are doing these things that they say in their mission, then everything works. Unfortunately, we are now in a place where there is a conflict between those two espoused values and the values that really are being shown to doctors and nurses working in healthcare.
All over. I mean, do you have anything to add to that, Charles?
I would say, I don't want to repeat what Catarina said so eloquently. It's more about the other side of that. When doctors that are motivated by more intrinsic value to patients, when they're preoccupied with things that don't enable that negativity, let's say the friction at work, and everything that surrounds the more day-to-day life of the business behind medicine, that can become a detractor from the provision of medicine. So it's exactly what Catarina said, but looking at the other side of what can remove value from the system.
You know, it's interesting that I'm getting the opportunity to talk to you two at a time where there seems to be this cyclone around healthcare. I mean, I just read where thousands of jobs are going away in healthcare, yet there are tons of needs, primarily with such a huge boomer age group needing healthcare. How are you folks addressing that today?
Catarina, do you want to take the first step?
Sure, I'll be happy to do that. And, what is really needed to be able to evaluate that? Because we're going towards a system that has less providers, less resources, and more patients. And patients that live much longer. So how do we really knit that together? We believe in Aktum Group that having access to an assessment that really looks at the whole system, what's driving the people, where are the roadblocks, which teams are not working, how are the leaders doing, how can we strengthen the teachers, to have data that really reflects that, that's what we think is the key, because then you would know what's really the problem, what is the root cause. So you want to be able to collect that data and do people analytics in a very efficient way.
So how's that coming along, Charles?
That's a great question. I would say Catarina is one of the leaders in the space. They're actually the first entry to this field. And I want to build on what Catarina said about we have decreasing numbers of providers, more patients, and the extension of life. Another element of that is going to be what we call the compression of morbidity. So not only people are living longer, but how they age is different too. So where people analytics comes in, what Catarina is saying is we know the constraints within our system. So we're starting to apply this approach, data analytics, gather the data necessary to actually say, how can we do more and better stuff with less? So that's where, when you look at the healthcare ecosystem, we started with values. How do we enable or identify those areas that are really impeding the provision of medicine? How do we better structure that so that we can try to solve the other challenges, such as training more doctors? But we certainly can't prevent people from living longer, or we don't want to do that at all. But so this is a great avenue to see true application. And I would say, you asked a specific question, how's that going? I think it's going well because this is a newer phenomena and Aktum is at the very tip of the spear. So that means there's a lot of proving out. Does this work? What does that mean? And helping carry that message across. Because Catarina, she said it's been a journey. It's because you have to create an entire field. It's not simply just going there and running, let's say, surveys. It's really setting everything up and making sure people have trust in the system for probably the most sensitive area in the nation or sector in the nation. So does that answer?
Yeah, no, it is. It really is. Without getting into the actual analytics, you answered it beautifully. At 30,000 feet, it was perfect.
Wonderful.
So you both know that I come from a recruiter background. And so in the organization I work within, there are a tremendous amount of recruiters that deal with healthcare. So let me start with you, Catarina, from the standpoint of what advice would you give a recruiter approaching the hospital, doctors, nurse, that type of an area that would benefit them, not the recruiter, but the hiring authorities? What could we do better to benefit them in your eyes?
Thank you. Very good question. And a $1 million question, right? First of all, I want to go back to what I said previously, understanding what the values are of the doctors and the executives who are looking for these jobs. Why are they doing it? What are they curious about? Then understanding the problems that exist currently in healthcare. Few of them is that burnout and autonomy, having access to what you do, when you do it, be interested in the work you do is key. And right now we see so much burnout in the healthcare system. So having support by the infrastructure, nurses, administrative help, having scheduling flexibility, and having hours that are livable at work, considering having a family balance between your work and your family, that's really key. If recruiters can identify organizations that have that, or ensure that the people now being hired in that organization would be able to have that, that's a lot of success because it's really urgent. Because now we have 40% of the doctors in the United States are over 55.
Oh my gosh. So what does the data show over the next, let's call it 5 years, Charles? What does the data show is going to potentially be the drop-off with that age group of doctors?
Oh, let's make a parallel within healthcare and pharma. These both represent the industries where you're going to see a highly complicated and long training requirement, meaning you just don't go for an undergrad degree. You have to receive that, then almost have an apprenticeship to then be in a position to work. So that means the time to train is taking a long time. So we look at that. We know that pharma and healthcare, to Catarina's point, there's a substantial percentage over 50. I do believe in the pharma industry, which is one of the industries we have the most information, because physicians on the alternative can still practice to much later in life. It's just much more of a question of what capacity. Regardless, we're seeing that about between 25 and 40% of that older 50 plus is in the workforce, and that's going to represent most senior positions. So that means in the next 10 to 15 years, there's going to be a substantial brain drain, as was a good terminology, that it's going to be difficult to replace if at all possible, because the training isn't keeping up with just the simple displacement, let alone the increased labor need. So that means from healthcare, we're going to get into a system or soonly evolve into a system where the shortage of any type of healthcare provider, not just physicians, nurses, is going to become so acute, it will start to impact how the medicine is given, like triage and everything. And that's to the point of Catarina's, how you recruit there that means it's a much more complicated conversation that you simply can't distill a conversation with a physician such as Dr. Dolsten here to a paycheck, because there's still compensation will be there. There's going to be conversations that arise. What does this system look like that I'm going to enter? And all those drivers that people analytics is hoping to identify. There's going to be an increased conversation there.
I'm kind of interested. You mentioned something and it just flashed in my head. And look, I'm a long-time member of the boomer generation. And it's interesting you bring up, and Catarina, you started it, but you mentioned something too here, Charles. Every doctor that I can ever remember engaging with wasn't doing it for the dollar. They were doing it for the passion that they loved doing. Some of the doctors that I've seen leave have left because of, they may use retirement as the reason, but the reality was they seem to be more restricted in what they can do for the patient. And how are we going to, in both your opinions, one is data, one is on the person's side, how are we going to be able to replace that care and passion when I feel, and I'm naive as can be, I feel the generation coming out of college and so forth, and I'm generally speaking here, is focused on the dollar more than they are the old care and passion for the patient. Am I misreading this?
I could start here, Catarina.
Yeah, please.
I will give it.
He is part of that generation.
Exactly.
Yeah, I'm younger, but I still notice the generational differences. But I would say if I were to boil this down, we've lost sight of really the people within the system, and really it could be perceived as the younger generations are more of a pursuit of a dollar, or I could say the alternative perspective is that the conditions have declined to a point that we think they should just be able to take it, that they're paid well. So then they should be able to take on that burden. And the best example of this is the new show, if anyone is listening or watching the show called The Pit on HBO Max. It captures the stress and like the declining working conditions that just makes it very hard. That I think about me personally, I'm in pharma and I have a PhD. I do not have an MD or any other medical degree. And I look at that and I was like, wow, I wouldn't want to trade, even if I made more than what I do in industry, to go to there for that risk, the burnout, the just true, I'd say, amount of pressure it puts on you. So all that to say, when we're looking to the younger generations, we're not looking at why they're doing this. It's really, the Pit describes it well, and that if we can try to improve the conditions to allow doctors to be their best, that really change the dynamic. And I would almost I'd bet a paycheck that we'd see interest in medicine increase again. So I'll pause there. Catarina, what do you think about that?
No, I think it's completely right. And I think there is the Gen Zers that we have, and even younger millennials, they really value balance between life and work. They want to have flexibility. They want to develop. And I don't think healthcare right now is providing those opportunities. It's, like most doctors know it's going to be a grind. You know that when you apply to med school. You know it's going to be long hours. You know it's going to be difficult sometimes with the work-life balance. But when it's all the time, whatever level you're at in seniority, that breaks the camel's back. Yeah. It's like, I feel that healthcare has become more transactional than transformational, because it's so much about insurance. It's so much about administration. It's so much about turning patients away that can't get it. And it's so much about how many patients can you treat today instead of what quality are you affording. And we can even see that in the ratings of the doctors, right? Doctors are being rated now by the patients. And it's really regarded to be so important in healthcare. And I agree, it is important. But you also have to understand what quality are they giving. Do you want a grumpy surgeon who's done this for 30 years? Or a sweet-talking little guy who's done it 2 years?
Yeah.
So I think how we evaluate doctors' performances are too simplified, oversimplified.
I agree with that
Analytics.
100%.
Yeah.
So where do you two feel the value of AI and telehealth is going to play a upgrade in the healthcare system?
I can start, Catarina, or do you want to start?
Yeah, please. No,
Okay.
Go ahead.
AI is near and dear to my heart. I can geek out about it. I would say when we look at AI, it's better to, especially in healthcare, it's best to kind of boil it down into three big areas that's going to innovate. First is going to really connect everything. We're going to be able to understand patient data and actually be able to have that pulled through to be analyzed, generate insights faster, different separate functions. You will now have a central repository of data. So basically, there's no longer those silos, or they're going to be broken down more deliberately. Then the other piece is that given cost constraints in a healthcare system, capital investment typically lags. So that means now you're going to see the deployment of tools and solutions at a cost point that's going to see all those inefficiencies potentially erode. Think about from lab work, we used to write paper notebooks, or people would write case notes on pen and paper. Now that's digital. So you're going to see that more modernization. And then the third piece is, I think when you look at how those two things come together, is that now you have digitization, connection, and you have actual deployment in the healthcare system. So it's going to allow you to do different things. And that's where I keep coming back to people analytics and Aktum, and that people analytics and Aktum represents much more of a broader movement into, hey, we have all this data. We have the capability now. What can we do differently? So it starts to have a conversation centered on the art of the possible in the healthcare system, meaning, does a social worker need to have a caseload that's 50 patients? Can we streamline that differently? Is there ways that we can mitigate some of the litigious nature or risk within healthcare? Maybe, maybe not. So all this to say, AI is going to have a profound impact that goes beyond what you just read on the news of diagnostics and development of drugs. It's going to be much more profound into augmenting doctors and other healthcare professionals to do what they love better, and hopefully eliminate a lot of these things that detract.
Yeah. I think the usage and the format that you use these things in and for are going to be essential. So are you using AI and digitization just to simplify things or make it more effective? Or are you actually using it and transforming healthcare so that it actually comes closer to what healthcare is all about?
Well said. Well said.
So I think you have to be very subtle and very careful in how you put these things in. And I can use electronic medical records as an example. So when Obamacare, ACA, was introduced, it was also required by all healthcare systems to have electronic medical health records. And that sounded good and well. The problem is that where electronic health records have been is, you remember the first computers where you logged onto internet through the phone and it was ding-dong, 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 the modem was dinging, and then you had to wait a little bit, then you had to have some words to be able to log in. Like, it just felt like made in the garage, etc. And it was made in a garage, right?
Exactly.
That's where we are with the electronic medical records. They are very inefficient. They put so much strain and administrative responsibilities on doctors, on nurses, on administrations. They're not simplifying healthcare. They're actually making it much more difficult. So putting enough energy and money into developing these healthcare systems so we get a Mac, right, that we just open and is very user-friendly is essential. That's just one example.
So what's your position, both of you, on telehealth?
Catarina, you want to go there first?
Sure. So telehealth really blew up during and after COVID. And it's been a way that to offload patients having to travel to the doctor, but also offloading doctors and nurse practitioners, because then they can maybe have one day they're working from home, which was impossible before COVID. And that's been a lot of effectiveness around that and how care and treatment has been provided to patients. You also see the patient in their day-to-day, right? And you hear the noises behind the kids or whatever it is, right? That also gives you a good picture of what's going on. I think to be able to strengthen e-health and make it develop it even further is going to be fantastic. One issue right now is that in the United States, the doctor has to have license in the state that the patient is to be able to provide care, which means we have rural areas who cannot access expertise. That's something that the Congress needs to deal with.
Yeah. Catarina, you took the words out of my head. I will say is that there's a need and a desire to grow, and there's a lot of things that haven't caught up. And I would say, I'm not going to repeat what Catarina said. I will just give you a commentary on how there's an urgency now to have Congress and others really modernize and really, I'd say, accept the demand or that's there, because what we're seeing is an absence of working this out. People are turning to, say, AI, like just chatbots for their general diagnostics, like, am I sick, for therapy. So there's a lot of things that telehealth can fill, that you'd have a trained and qualified professional behind it. But due to a lot of things needing to be called up and like refined to reflect the modern world, it's not, people are falling through and they're having to go to other solutions. So in some cases, that just means no care. The rural example Catarina explained, or going to chatbots, which they may have a purpose in the future, but they're not a stand-in, in my opinion, in the current configuration from a physician. You still need that doctor touch. That's just my opinion there.
No, I totally agree. I mean, I got to tell you, first of all, as a recruiter, right, my experience of watching and using AI in the simplest, because I am not a technology person, I'm disappointed in, because the AI part of it comes from, it gathers information from everywhere, and then it creates a conglomerate of that information and feeds that to you. Well, to give you an idea from my background is, people aren't doing their own resumes. They're sending it out to have the resumes done by AI. They're sending out the first interviews to be done by AI. There's no personal touch. And the people that I deal with from the candidates, you write your own resume. Because in my world, I want this to be a real thing, not something that somebody else makes up. And so now let's fast forward back to the doctor part of it. I come from, when I go to my annual physical, right? The doctor, it's touch, feel, look. I mean, they're examining my body. How do they do that? Through technology. Either one of you can answer that one.
The world's catching up. I would say, I love this topic as a whole. I would say that telemedicine technology used remotely has a time and a place and a purpose. It's more we need to define what it can and can't do. That means Apple Watches and other stuff right there. Those patient-reported outcome type devices, really good at predicting a heart attack or you're falling, but that's not diagnosing on cancer from a remote area. So I view it as communicating what it can and can't do. But then ultimately, you have to have that human touch because it's like with pharma. The buck stops with the drug in pharma and it stops with the patient here. You want to ensure that you're getting it right. And if you want an analogy for people that aren't in healthcare, others, think about Salesforce and how sales reps are going about with the invention of AI. We're cutting costs out of there, but guess what? Every single leader wants to look someone in the eyes before they sell a $500 million project. No one's really signing up for that. So imagine that on a much more pronounced and deliberate scale in medicine.
Yeah, I have, let me just add a little flavor to that. And that goes back to when I said I've seen so many different health systems. So in one program I worked with in sub-Saharan Africa, we had these healthcare workers. They had done just basic training, went out on the field, and they got algorithms in their phone to ask. So let's say you have a baby and the baby has fever. Okay, so then what is the fever? How long has it been going on? Next question, is the baby coughing or not? He's not coughing. Next question, have you used bed nets so that the baby didn't get malaria? No, we haven't. Oh, then you can take a little prick in the finger and test that and take it back. So I mean, what I'm trying to say, let's say we would do the same thing here in the United States, right? You would have access to doctors in any university, Yale, Harvard, etc. But you have a nurse in that location that can do the human touch. Because we have many more nurses than experts.
Boy, yeah, I mean, it's so comforting to hear you two talk about the future that way, because the naive person, such as myself, the commoner, we hear all the media garbage and they put their spin on it. But hearing from the professional, I mean, I drill my doctor annually. What's coming on? What's happening? What can I expect? How do I deal with it? So it's all about communication. It really is. And I have one final question for both of you to answer. And it's really looking at it from the Aktum point of view, okay? Catarina, let's start with you. What excites you about the next 5 years?
What excites me? Well, what I'm really excited about is to bring that systems thinking that exists in organizational development psychology to reality by looking at complex systems like healthcare. Like healthcare is one of the most complex systems where people are working. And using that to be able to predict what's needed. Where are the roadblocks? How are the leaders doing? Which teams are not working well together? How can we access that? How can we give them some extra learning and teaching them how to navigate different problems? That excites me tremendously.
So Charles, now I know I'm lighting a fuse here.
Yes. No,
because you wear your passion on your sleeve, okay? Yeah. Taking it from the data analytics side of the picture.
Yeah.
What excites you?
Yeah. I would say I'll tie it back to Aktum and people analytics, be a very small and direct answer, because I'm excited about a lot of things. But if we look at people analytics and what Aktum's doing broadly, we're trying to identify new trends with data. So what excites me about the future is that first, there's a belief that there will be an acceptance of some of these trends matter. It matters that the mental health of a doctor to provide better care for a patient. Let's see, there's going to be an acceptance. But more importantly is AI is just one avenue to this, but there's an advancement in technology that allows us to actually act on it. It used to be you had to have a very big, robust business case, and it had to make a lot of money. Now we're going to have an appreciation of smaller factors and the ability to action and create so that it doesn't have to be, the innovation doesn't have to come from this big philanthropic organization. It can be Aktum leading the charge, or it can be Aktum identifying a trend and then systems adapting and taking those insights and applying it more broadly. So, yes.
Phenomenal.
It's all about collecting the right amount of data and knowing how to boil it down and cut it.
Exactly.
Work in progress.
Yes.
Thank you both for taking the time again. and I've really, really enjoyed the conversation. It's helped me get a little better peace of mind moving forward, and knowing that the personal touch is always going to be there, that it isn't just going to go to technology. Again, I thank you both for everything the time, everything you've given to this.
Thank you.
Thank you,
Thank you
Vince.
so
Thank you,
much.
Catarina.
It's been amazing. Thank you.